Hi guys, I did my condition presentation on major or mild neurocognitive disorders due to traumatic brain injury. So this was a very interesting topic for me because I'm a boxer. So I've had some boxing coaches that I can definitely see some traumatic brain injury symptoms. So this is really interesting to learn more about, and I included some information about it at the end of my presentation. So the introduction for neurocognitive disorders. Although cognitive deficits are present in many, if not all, mental disorders, for example, schizophrenia or bipolar, only disorders whose core features are cognitive are included in neurocognitive disorder. So cognition is defined as mental processes involved in gaining knowledge and comprehension. So that includes thinking, knowing, remembering, judging, problem solving, and language. So we see in neurocognitive disorders an effect in these areas, in these mental processes. So if you guys remember the movie The Vow with Rachel McAdams, we see that she gets into a car accident and has traumatic brain injury. So we see that she wasn't born with this difficulty in mental processes such as thinking, knowing, remembering, problem solving. We see that it's after this car accident and her traumatic brain injury that she can't remember her current life. She can't remember that she was married. She forgets her husband, he doesn't even know who he is whatsoever. She only has memories up until her young adulthood. So a traumatic brain injury will affect these things, such as this mental process, such as remembering. Neurocognitive disorders are those in which impaired cognition has not been present since birth or early life, and thus represents a decline from previously attained level of functioning, as we see in Rachel McAdams' character in The Vow. Neurocognitive disorders are unique among DSM-5 categories in that these are syndromes for which the underlying pathology, which means the cause and effect of diseases, can potentially be determined. So, for example, cognitive decline in an individual's learning, memory, or language due to a blow to the head during a car crash versus not being certain how one twin will be diagnosed with autism and the other isn't. So what that means is we have an understanding and we can really kind of, determine the cause and effect of someone's neurocognitive disorder because it's usually resulting from a blow to the head versus autism, where we're not exactly sure how someone develops it quite yet. And, we've seen studies on how one twin can be diagnosed with it and the other isn't. And they're, what we would call atypical normal. So an overview of the condition: major and mild neurocognitive disorders need to be specified by one of the following medical etiologies. So Alzheimer's, Lewy body disease, traumatic brain injury, substance medication use, HIV infection, Parkinson's disease, Huntington's disease. So all of these medical etiologies cause cognitive deficits that were not present at birth, but rather were developed due to disease or traumatic brain injury. The diagnostic criteria for traumatic brain injury includes the criteria are met for major or mild neurocognitive disorder. There is evidence of a traumatic brain injury, impact to the head, or other mechanisms of rapid movement or displacement of the brain within the skull, with one or more of the following. So they need to have either loss of consciousness, post-traumatic amnesia, disorientation or confusion, or show neurological signs, which could be the new onset of seizures, marked or worsening pre-existing seizure disorder, visual field cuts, etc. And the last criteria would be the neurocognitive disorder presents immediately after the occurrence of the traumatic brain injury or immediately after recovery of consciousness and persists past the acute post-injury period. So specifiers: the severity of neurocognitive disorder is rated at the time of injury or the initial assessment, and it's rated as mild, moderate, or severe. So an example would be the injury characteristic would be loss of consciousness. Other characteristics could include post-traumatic amnesia, disorientation and confusion, so those such things. So if we're using the example of loss of consciousness, a mild traumatic brain injury would be that the individual had loss of consciousness for under 30 minutes. Moderate, to be rated moderate traumatic brain injury, the person would have to have loss of consciousness for 30 minutes to 24 hours. And then severe traumatic brain injury would be rated as someone who has loss of consciousness for over 24 hours. Risk factors and comorbidity. So cognitive presentation is variable. It varies amongst individuals. Difficulties are present in domain functions such as complex attention, executive ability, learning and memory, slowing and speed of information processing, disturbances in social cognition. Risk factors that we see, the highest prevalence and most common forms of traumatic brain injury in kids under the age of 4 results from falls. So then when we get to the older teens and young adults, most common forms of traumatic brain injury is from sports. And then when we get into older adults over 65, majority of their traumatic brain injuries is also from falls. So comorbidity, individuals with substance use disorder, the neurocognitive effects of the substance contribute and compound the traumatic brain injury associated with a neurocognitive change. Some traumatic brain injury associated symptoms may overlap with PTSD symptoms, and the two disorders may co-occur, especially in military populations. So what that means is that there are some similar symptoms in PTSD and traumatic brain injury. So for example, if there was a military member who was in combat and maybe saw an explosion and maybe saw dead body parts laying around. So that could cause difficulty in attention and focusing. It could decrease their ability to learn and affect their memory. So we see that in PTSD, and we also see that in traumatic brain injury. So this is how those symptoms overlap, and they could also co-occur. So a military member who saw this, combat and dead body parts could have PTSD from that, and then they could also have the traumatic brain injury from maybe that bomb going off and it threw them back against the wall, and it was a blow to their head. Maybe something fell on top of them after the bomb exploded. So we could see that these two disorders could overlap. And finally is the boxing information. So it was interesting to learn that 90% of boxers suffer from a brain injury of some extent during their career. The one website said that the force of a professional boxer's punch is equivalent to being hit with a 13-pound bowling ball traveling 20 miles per hour. So it makes sense that repetitive blows to the head would cause symptoms, so it makes them more susceptible to Parkinson's and Alzheimer's later in life. And then the website also stated that helmets could cut down on injuries, but it's not often used in professional boxing due to decreasing the thrill, and it doesn't appeal to supporters. So that was my presentation on neurocognitive disorders, and I hope you enjoyed.